It really hits you when you see the scale of the problem. Over 120,000 people in the U.S. are waiting for a life-saving organ transplant right now.
It's a huge number.
Yeah, and tragically, in just 1 year, 2015, more than 8,000 of them died because, well, an organ didn't become available in time.
That's heartbreaking.
It is, especially when you realize how many potential donors there might actually be each year. It's this stark contrast, immense need alongside this significant pool of potential donors, yet donation rates are still a challenge. That's what we're going to unpack today.
Yeah, it really underscores a fundamental bottleneck, doesn't it, in our ability to save lives. We have the surgical skill, the medical knowledge, incredible procedures, but the crucial limiting factor is consistently the availability of, well, healthy organs.
Right.
And this scarcity has a huge impact, not just on the individuals waiting, which is terrible enough, but on the whole healthcare system.
Exactly, and makes you wonder, are there existing medical technologies, maybe ones used for other things, that could offer some kind of solution here? Well, that's precisely what we're diving into. We're going to explore the fascinating potential of hyperbaric oxygen therapy, HBO they call it. It's a treatment already used for various conditions and how it might just, well, revolutionize the world of organ transplantation.
Right. For those who might not be familiar, hyperbaric oxygen therapy, it basically involves breathing pure oxygen inside a pressurized chamber.
Okay.
This significantly boosts the amount of oxygen that dissolves into your bloodstream, which can have a whole range of beneficial effects on the body. We know it helps speed up healing in difficult wounds, fights certain infections.
Decompression sickness, too, right? Like for a diver.
Exactly, decompression sickness. So it's got established uses.
Right. And when we look at the underlying science, HBO seems like it could be a real game changer in transplantation, mainly because of its documented effects. Think about its ability to reduce that damage. Ischemia-Reperfusion Injury, they call it. When blood flow stops, then starts again.
IRI. It's a big one.
And it can influence the immune system, reduce swelling, inflammation, and dramatically boost oxygen in tissues. Yeah. So the key thing here is HBO doesn't just target one problem. It tackles the oxygen deprivation, the sort of inflammatory storm, even the immune response. It's like a comprehensive approach to give the new organ the best possible start.
Precisely. Our mission in this deep dive is to really get into the research, the case studies, to understand exactly where and how incorporating HBO therapy, maybe at different stages of the transplant journey.
From donor to recipient?
Yeah, from the donor to preserving the organ and finally to the recipient, how it could offer significant advantages. So let's start by addressing the critical issue underpinning everything, the organ shortage itself.
Okay, let's unpack this. Why are donation rates relatively low in many places? Like the U.S. with its opt-in system, where you have to actively sign up to be a donor?
Well, there are several factors. Cultural and religious beliefs, they definitely play a role for some people. Concepts of bodily integrity, what happens after death, that's deeply personal. But it's also, I think, highly probable that just a lack of widespread public education and awareness is a major factor. Awareness about the urgent need, about the process itself. Many people might simply not have the info they need to make that kind of decision.
It's striking that our sources highlight the opt-out model, like in Spain and Austria, where you're assumed to be a donor unless you specifically say no.
Right.
And those countries tend to have higher donation rates overall, though interestingly, sometimes lower rates of living donation. It really shows how policy choices can make a big difference.
It does. And Spain is often held up as a really successful example. They don't just have opt-out. They also have this highly effective national and regional setup for organ donation.
Like good coordination.
Exactly. It ensures that when a potential donor is identified, the whole process, retrieval, allocation, happens quickly, efficiently, minimizing that time the organ is without blood supply. And as we'll get into, time is absolutely critical here.
Right. And the sources also touch on ethics, especially around live donation. The WHO emphasizes maximizing deceased donor organs to, minimize any potential for exploitation with living donor.
Which really highlights how important it is to make every single deceased donor organ count.
Absolutely.
So, given this shortage, any intervention, anything that could extend how long a donated organ stays viable outside the body or improve how it works after transplant, that would be immensely valuable. And this is where the promise of HBO really starts to come into focus.
Okay, so let's dive into that promise, the core idea. HBO could potentially give us more time with these precious organs, maybe lead to fewer complications for recipients. How does it stack up against what we do now, current preservation methods?
Right now, the standard is basically static cold storage. You flush the organ with a cold solution to get the blood out. Then it's double-bagged in sterile solution, packed in ice. Simple, effective to a point.
It slows things down.
Exactly. The cold slows the organ's metabolism, reduces its oxygen need, limits damage from lack of oxygen. But it's not perfect. Even cold, cells are still doing things, slowly. And damage accumulates oxidative stress, inflammation, changes to the cell's structure, the cytoskeleton.
And this damage during cold storage, our sources point out, is directly linked to how bad that ischemia-reperfusion injury, the IRI, is going to be once you transplant it and blood flow returns.
That's a crucial connection. And IRI, well, it happens in all deceased donor transplants, but it's significantly worse in organs from donors after cardiac death DCD donors where the heart stopped before retrieval.
Yeah.
Those livers, for example, are often seen as, let's say, lower quality, used less often than ones from living donors or brain-dead donors who still have a heartbeat. So given HBO's known ability to combat IRI, this is a major reason for the growing interest.
Okay, so let's get into the nitty-gritty. What exactly is ischemia-reperfusion injury, and how does HBO step in to potentially lessen its effects?
Okay, imagine an organ suddenly losing its blood supply during the transplant process. That's ischemia. No blood flow means no oxygen, no nutrients getting to the cells. Waste products build up.
Not good.
Not good at all. The cells switch to a less efficient energy production, anaerobic metabolism, builds up lactic acid, that damages cells. But here's the kicker. Often, the real damage happens when blood flow is restored. That's the reperfusion part.
So it's like the body trying to fix things actually makes it worse, in a way.
In a way, yes. The sudden return of oxygen, the pH normalizing, it triggers this damaging cascade. Calcium-dependent enzymes go into overdrive, and you get a massive burst of reactive oxygen species, ROS.
Yeah.
These are highly unstable molecules that just wreak havoc on cell structures.
Wow.
And this IRI, it's linked to a whole range of post-transplant problems. Delayed function of the new organ, higher risk of rejection by the immune system, even long-term chronic dysfunction.
That sounds like a huge hurdle.
Yeah.
So how does HBO fight back against this onslaught?
Okay, this is where it gets really interesting. Animal model research shows HBO uses several key strategies. First, it helps the body make more nitric oxide, NO.
Nitric oxide. That helps relax blood vessels, right? Improve flow.
Exactly. Think of it as keeping the pipes open, blood flowing smoothly. Second, it boosts levels of something called superoxide dismutase, SOD. SOD is like a powerful cleanup crew for those damaging ROS molecules.
So it's protecting the blood vessels from clamping down and cleaning up the damaging byproducts. What else?
It also plays a crucial role in stopping certain white blood cells, neutrophils, from sticking to the blood vessel walls in the transplanted organ. This blocking of neutrophil adhesion, CD11-18 mediated adhesion, is important because these inflammatory cells cause a lot of damage during reperfusion. Plus, HBO directly inhibits ROS formation and cuts down the production of inflammatory signals, cytokines, interleukins, basically calming the whole inflammatory response.
So many different angles.
Yeah, all these actions work together. They protect the delicate lining of the blood vessels, prevent the support structure around them breaking down, and guard against the failure of the tiniest blood vessels, the microcirculation, making sure blood can actually flow within the new organ.
It's fascinating how multi-pronged it is. Our sources even mentioned some researchers looked at using inhaled carbon monoxide to reduce chemokine activation from IRI.
Right, I saw that.
But I mean, using a known toxin when you have a safe alternative like HBO, it doesn't seem to make much clinical sense, does it?
Exactly. HBO offers a much more logical, much safer strategy for tackling IRI. But, the benefits don't seem to stop just at reducing this immediate injury. It also looks like it has a role in managing the recipient's immune response, helping prevent rejection.
Okay, let's shift gears then. Talk about the immune system connection. Rejection is always a big concern after transplant. What's the link with HBO?
Well, transplant rejection is complex. It involves activating the recipient's immune system cells, like CD4 cells, macrophages, and certain molecules on the donor organ cells, MHC1, plus specific antibodies, can trigger rejection.
Okay.
Now, sources indicate HBO has been shown to decrease the number of those circulating CD4 cells. It can also reduce the expression of MHC1 on cells and suppress the production of cytokines that would normally ramp up the immune attack.
So it sort of dampens the alarm signals.
That's a good way to put it. It appears to have this modulating effect on key parts of the immune system involved in rejection.
It sounds like it could really help tip the balance towards acceptance.
Yeah.
It's surprising then that it isn't more common in transplant protocols already. Especially since, as our sources mentioned, this idea isn't totally new.
That's right. There were studies back in the 70s that looked into this, showed some promising early results. But for whatever reasons, it didn't really catch on clinically back then.
Hmm.
But now, with the organ shortage getting worse and the increasing use of these expanded donor criteria organs, ECD organs,
Organs that maybe aren't perfect, but we need to use them.
exactly, organs from older donors or donors with some medical history, out of necessity, we're using them more. So there's this renewed, significant interest in re-examining HBO's potential. Plus, the fact that it's generally seen as safe and relatively inexpensive makes it even more attractive.
So let's get down to specifics. What does the research, including those older studies, tell us about how HBO might help with different specific organs? Maybe start with the lungs. They seem particularly fragile.
Yeah, lung transplantation is really challenging. That ischemia-reperfusion injury is a major problem. We know IRI in the lung involves white blood cells from both the donor lung and the recipient's body.
Both sides.
Both sides. Currently, one strategy is using a heart-lung bypass machine with a special filter to pull white blood cells out of the recipient's blood before you restore flow to the new lungs.
But HBO might offer a simpler approach.
Precisely. Because a single HBO treatment seems to reduce that white blood cell stickiness for up to 24 hours, you could potentially treat both the donor once the decision is made and a recipient found, and the recipient before the operation.
That could tackle the inflammation from both sources.
Potentially, yes. And furthermore, lungs have a really short preservation window, max 8 hours, sometimes even less than a heart. HBO may be used alongside newer preservation techniques like warm or slightly cooled perfusion.
Keeping blood flowing through it outside the body.
Right. It might help extend that crucial time. Early attempts at warm perfusion for lungs hit problems with IRI and swelling, but maybe HBO is the missing piece to make those advanced methods work better for lungs.
And it's not just about preservation and the immediate surgery aftermath, is it? Sources mention HBO for later complications, too.
That's correct. There are case reports showing HBO is safe and effective for things like sternal osteomyelitis, that's a chest bone infection, respiratory infections, even certain blood clots after lung transplant. And there was that small pilot study, unfortunately disrupted, in New Orleans. Looked at patients with chronic lung rejection. Even though it was cut short, some patients felt subjectively better, breathing-wise. A few showed measurable improvements in lung function tests. One patient who got quite a bit of treatment had a notable increase in lung capacity, could exercise more. Small study, but it hints at a role even for managing longer-term issues.
That's definitely encouraging. What about pancreas transplants? We know IRI is a big deal there too, right? Graft pancreatitis?
Absolutely. Inflammation of the transplanted pancreas, graft pancreatitis, is a major complication. Animal studies, often using pigs, show how IRI and something called lipid peroxidation contribute, and research on transplanting just the insulin-producing islet cells.
The beta cell?
Exactly. That research shows HBO treatment around the time of transplant can improve survival and function of those delicate cells. One rat study found intensive HBO both before and after transplant led to better long-term function and more beta cells surviving.
That sounds promising, even if translating intensive animal protocols is tricky.
It is tricky, but the results are definitely promising. And it suggests HBO's role might go beyond just the immediate surgical period. It's also reasonable to think, like with lungs, that white blood cells from both donor and recipient contribute to IRI in pancreas transplants. So HBO could potentially address both sides there, too.
Okay, moving on to kidney transplants. They're the most common. What's the evidence there?
Well, given that kidney transplant was the first successful solid organ transplant, there's a lot of research. And IRI is well established as a major cause of acute kidney failure and early problems, especially in transplants from deceased donors.
Right.
We are seeing more use of machine perfusion now to preserve kidneys, especially those ECB kidneys we mentioned. And it does show benefits: less delayed function, better long-term survival.
So pumping fluid through them instead of just cold storage.
Exactly. And what's particularly exciting is research combining HBO with machine perfusion. Studies using transportable chambers have shown that adding HBO to that perfusion fluid can significantly preserve kidney function for up to 48 hours.
48 hours? That's huge.
It's a really significant potential extension. It could allow for organs to be shared over much greater distances, give more time for matching.
Wow. Okay, what about liver transplants?
Yeah.
Also complex, dealing with end-stage liver disease.
Very similar story to kidneys, actually. Liver transplant is standard for end-stage disease, and again, IRI is a major player in poor outcomes, delayed function, even primary graft failure, driven by neutrophils, ROS,
The
cytokines,
usual suspect.
the usual suspects. Interestingly, there's been more extensive research on HBO and liver transplants compared to some other organs. Beyond IRI, case reports have looked at HBO as an add-on treatment for things like hepatic artery thrombosis, blood clots, and primary graft dysfunction. Some showed liver function actually normalizing after HBO was started.
Our sources also mention this fascinating link, liver injury after transplant leading to lung injury. How does that work?
Yes, it's a really interesting phenomenon. It seems chemokines, these signaling molecules, get released from the damaged liver tissue due to IRI. These chemokines can then travel to the lungs and stir up inflammation and injury there. So the thinking is, by using HBO on both the donor liver and the recipient, maybe you reduce liver IRI, disrupt that chemokine release, and potentially protect both the liver and the recipient's lungs.
A double benefit.
Well,
That's intriguing. And it seems HBO might even help before the transplant in some liver cases.
there are case reports suggesting that. Using HBO on potential donors to improve the liver's condition while still in the donor, before removal, with the liver then working well post-transplant. There was also a study on patients waiting for transplant with failing livers. HBO didn't significantly improve standard liver blood tests immediately, but it did reduce a specific brain complication in some.
Encephalopathy.
Right. They didn't get HBO right before transplant in that study, but it raises questions about potential benefits of pre-treating the recipient. And older research even suggested HBO can help liver regeneration in cirrhosis.
And for living donor liver transplants where they use just a piece of the liver.
Exactly. Small for size grafts. Research in rats, where they removed a significant part of the liver, showed that pre-treatment with HBO led to more growth of the remaining liver and better function compared to controls. Similar positive effects on regeneration after smaller resections too. Rats treated with HBO had more normal liver structure.
So the potential uses in liver transplant seem quite broad then.
They really do.
Yeah.
From potentially bridging patients to transplant by improving their own liver, to enhancing deceased donor livers, improving regeneration of whole or partial grafts, fighting IRI, and even treating post-transplant complications. It covers a lot of ground.
That's a really comprehensive list. Now, what about some of the newer frontiers? Face and hand transplants. Does HBO fit in there?
Yeah, these are exciting fields, advancing fast. IRI and rejection are still factors, definitely. But face and hand transplants, because you're moving large blocks of tissue with multiple blood vessels, they have extra challenges. Significant swelling is a big one, partly because you can only connect so many small blood vessels.
Drainage issues.
Exactly. Now, HBO has a well-established track record in improving outcomes for compromised tissue flaps and grafts in reconstructive surgery. It reduces swelling, improves oxygen supply, could work well with other things they use, like leech therapy.
Right.
And furthermore, think about the recipient site for a face transplant. It's often damaged from severe trauma, multiple previous surgeries. Preoperative HBO could potentially improve that tissue bed, promote better blood vessel growth angiogenesis, making it healthier to receive the graft.
That makes sense.
Yeah.
And for hand transplants, similar thinking.
Yes,
Yeah.
very similar. And remember, HBO is already an accepted treatment for limb replantation after amputation. Hand transplant is just a highly specialized form of that.
True.
Studies show better results when HBO is used both before replant to help preserve the amputated limb and afterwards, especially if there's been prolonged warm ischemia, meaning lack of blood flow at normal temperature.
And the unique thing here is the donor aspect again.
Exactly. With hand or face transplants from deceased donors, you have this unique opportunity to potentially treat the brain-dead donor with HBO before recovering the hands or face, along with other organs, an extra benefit you don't get with traumatic amputations.
It's remarkable to think about improving the tissue in the donor.
Yeah.
What about other less common transplants? Heart, thyroid, small bowel.
Even there, early research, especially with hearts, looked at HBO combined with cooling for preservation. They got up to 48 hours viability in dog hearts back then.
Yeah.
IRI is definitely a factor in heart transplant too, mitochondrial damage. And HBO's been used for post-op complications like sternal infections after heart surgery. For other tissues, thyroid, small bowel, skin animal studies generally show positive effects of HBO on graft survival and function, probably, again, due to reducing inflammation and lessening IRI by inhibiting chemokines.
So looking at the big picture, it really seems like HBO could slot in beneficially at several key points in the whole transplant process. Can we sort of summarize those critical phases?
Absolutely. It looks like there are 3 main stages where HBO could be really valuable. First, treating the donor before organ removal. Giving the donor HBO could potentially quiet down those damaging white blood cells, lessen the initial IRI hit before the organs are even procured.
Okay, phase 1.
Second stage, during organ storage outside the body. As we've discussed, HBO shows promise with both standard cold storage and machine perfusion, helping reduce metabolic needs, limit waste buildup, minimize IRI, maybe extend viability, allowing use of more marginal organs.
Phase 2.
And the third?
Third stage, treating the recipient either before or after the transplant surgery. This could further reduce damaging white blood cell activity, lessen IRI in the newly transplanted organ, and potentially offer other benefits for the recipient's recovery.
It sounds like even a relatively simple intervention, maybe just one treatment, could have a really significant impact.
That's the encouraging part. Our sources suggest even a single HBO treatment for both donor and recipient within that 24-hour window around surgery could potentially lead to a substantial reduction in IRI.
And importantly, for most deceased donors, right, a single HBO treatment could potentially benefit all the recoverable organs simultaneously.
That's a really efficient potential intervention then. So to wrap things up, it really seems the evidence, especially from animal studies and just our understanding of IRI, strongly suggests HBO could be a very promising, effective addition to the transplant toolkit.
That's the central conclusion, I think. And it's encouraging to see growing recognition. You mentioned Medicare, for instance, including HBO, on a list of non-covered indications for some things. That sometimes happens as a precursor, as more evidence builds, before wider consideration.
Interesting. And when you think about the economics, organ transplantation is incredibly expensive already.
Hugely expensive.
The potential for HBO, which is relatively inexpensive, save to maybe increase the number of viable organs, reduce wastage, decrease post-op complications. It could actually lead to significant cost savings down the line.
Precisely. It's an area where a relatively straightforward intervention could have a really profound impact on a complex, costly field.
So the final thought I guess I'm left with is this. Considering how relatively easy HBO therapy is to deliver, the short treatment times, what could widespread adoption really mean for the future of organ transplantation and, most importantly, for the lives of those hundreds of thousands of people waiting for that second chance? It certainly feels like a field that's ripe for more investigation and hopefully widespread clinical use.